One thing I talk about a lot is being at the centre of your care in labour, but what does that actually mean? I thought it would be useful to go through a bit of an overview of what that means. And the idea behind this came from it along for many years of working with expectant parents, and it can feel like, especially when this is the first time that everybody else is the expert, that you need information and guidance and permission from everybody else around you to have your baby. And information and reassurance from other people and support is, really crucial. But ultimately, it's about what is important for you and what you need. And this is for all births. Whether your labour starts spontaneously, whether you're induced, whether you're having a C-section. So some of this can be adapted for whatever your birth is, because you and this baby have never happened before. And the needs that you have, which can change and vary throughout labour and birth, are important for you. So it is important to be able to continually have a voice and to say what it is that you need. So asking questions can be important, and this could be you, or depending on how your labour is unfolding, and whether you're, kind of if your hormones have kicked in and you're in established labour, this could fall to your birth partner. So asking questions so that you know kind of what's going on, what's happening, what your options are, what the next steps might be. So it's providing a level of understanding of kind of where you're at and what could happen next. Saying what you need is really important, because nobody's a mind reader, and you just might need something simple. But it could be that you need reassurance, that you need information. You might want to change position. It could be you want some water to go to the loo. All of those things that have to come from you. What's slightly challenging about this is, I think that, in everyday life, you're probably used to just doing this stuff for yourself. But when you're in labour, you might be in a position where you just kind of go, I need to go to the loo now. You wouldn't normally announce that, but the circumstances are slightly different. So just, you're not asking permission, you're just saying what you need to do. Being prepared for the practical things that you might need, so this is part of your preparation, can be really important, so that, changing position, help to change position, going to the loo, eating, drinking, the things that really could be unique and kind of down to your individual needs in that moment. So things like taking your own birth ball with you because you've used it in pregnancy, it's comfortable, it fits you. Preparing to kind of, you've got to take that with you, because that means that continues. You're not waiting for anybody to get it. You can remain comfortable at all steps when you're in hospital. But also thinking about the emotional support that you might need. Labour and birth can be huge events, and they can require you to dig deep. They can be quite challenging. There can be all sorts of emotions in there, and that emotional support can be really important, and that can be from your partner, that could be from your midwife as well. And to kind of know and understand that it really is okay to look after your needs, to be the center of things, to say what it is that you need and can that happen, and to kind of encourage more communication about what your needs are and what might need to happen next. And as part of your preparation, that can be about knowing more about what could help. in labour. So what it is that you might instinctively want to do so that you know to expect those things as well. So, kind of moving and using different positions being one example of that. And then with that comes knowing what might not be helpful. So, noise, interruptions, bright lights, again, really simple things, but those little tweaks can make a huge, huge difference. Being able to gather information both in pregnancy as part of your planning and preparation, and then when labour starts, so that you can make decisions if they're needed as labour unfolds. And a big one for me is knowing how to use your breathing so that you can be calm and be focused when you need to be. So if you can breathe, move, and focus on your body and working with your body, you're in a position to be able to help labour do what it needs to do, those contractions to be as effective as possible. But also, you're in a position to be able to ask for what you need. And that could be changes in your birth plan, because you might have written this thinking, I would ideally like to do this without an epidural, as an example. But dependent on how your labour unfolds, an epidural might be the best next step for you because you're exhausted or because it's been particularly intense, and that's the next step. And that's okay, because you need to be at the centre of your care. Therefore, you are in a position to make those changes as and when they're needed. Nothing is set in stone. None of this is prescriptive. It is about going with what you need. And the pace of labour will be what it will be. So if you can be at the centre of your care, you can change what you need. You can go with that if your labour's long. Equally, if your labour's really short and efficient, because maybe this is your second or third baby, and what you thought you might experience based on your first experience, which was longer, is just totally different. If you're at the centre of it, you can say what you need and put things in place so that you're maybe just having to focus on your breathing. You need support from partners. You need information from the midwives. Just be able to do this and to have your baby, because it's a lot faster than you expected. There is nothing wrong with being at the centre of things, because everybody can then work around what's happening in your labour and what you need. I hope that makes sense. Sometimes it's a difficult concept to grasp because it feels uncomfortable to be at the centre of things, and some people don't feel that assertive, but can make a huge difference. So jot down notes, what matters to you. Jot down as part of your birth plan what strategies might be important, and then you can build on that. And it is just a mindset about being at the centre of your care so that you can get that support from your partner as well as your midwife. And as a doula, that's what I would be looking for as well. And it's what I encourage in my conversations with clients. It's about what is going to be important to you so that I can get more in tune with that. And then when labour starts, I'm more mindful of what her needs might be. But she's already got my permission, don't like that word, but to speak and to have a voice. So all of this stuff matters. So it's just making this part of your plan.